हेलो एंड नमस्कार सभी को। मैं हूं आपकी होस्ट दिव्या एंड वेलकम टू टुडेज लाइव सेशन। We are back with another exciting topic, but before diving into the session, let me introduce you the new special offer from eGlobal Doctors where you can get the consultation with the expert doctors at just rupees 199. And the offer is valid only for India. So let's get started. For today's session, we have our expert Dr. Lata Rijhwani for today's session. Dr. Lata Rijhwani has done MBBS and postgraduate diploma in pediatrics from RNT Medical College, Udaipur, and postgraduate diploma in dermatology from Cardiff University, UK. And currently, she is practicing at Jaipur. Lata ma'am, you always bring lots of information to our viewers, so it's really nice to meet you virtually. And today, we are going to discuss about the under-eye darkness and its treatment.
Thank you, Divya. First of all, thank you once again for having me here. And it's always pleasure to talk to you about the common dermatological issues. Thank you.
So, my first question is, what are dark circles and how may they appear?
See, everybody is familiar about this problem, and everybody, as it is such a common issue, I think mostly maybe more than 50% of the population, especially the females, they have experienced this at one or the other stages of their life. So, any darkness or discoloration around the eyes generally is known as periorbital melanosis, periocular melanosis, and we also know it as dark circles for a lay person. And they may appear as blackish, brown. Sometimes the puffy eyes also do give an impression of dark circles.
Okay. So, ma'am, moving to our next question. So, what are the causes of it?
Yeah. Divya, broadly categorizing, I will divide the causes into exogenous causes and endogenous causes. Endogenous causes means the intrinsic causes, as to make it more simpler and to make it easily understandable for all of the viewers. The endogenous causes means mostly it constitutes the genetics of a person, like constitutional causes. And then there are other causes like related to some disease, internal disease, like puffiness can be related to renal problems, thyroid issues. Then there are some deficiencies, vitamin deficiencies, especially iron deficiency, vitamin B12 deficiency, vitamin K deficiency, which is associated with periorbital darkening. And then there could be chronic eczemas, like especially those people who have chronically dry skin around the eyes, chronic atopic dermatitis. They can also have, dark circles. And talking about the constitution, the melanin pigment, which is responsible for the color of the skin and color of the hair, the distribution and amount is always determined by the genes. So, for example, if your mother and your grandmother, they were having dark circles, you will tend to have dark circles. The tendency will be more. So, 50% of the times it is constitutional. So, you see, it is very important to rule out genetics. Then again, coming to the causes, there can be the people who, they have some errors of refraction. They also tend to have dark circles. So these are the causes which are endogenous. Then talking about the extrinsic causes, smoking is a very important, smoking, alcohol. Then stress is very important. Those people who have faulty lifestyles, they are not sleeping on time, they are not sleeping adequately. And most of the times they are in front of screens. Such people tend to have dark circles also. So these are some of the extrinsic causes which are very important, and most of the times they are in our control. We can always take care of them.
Yeah. Okay. So, thank you, Lata ma'am, for sharing the causes of dark circle. So, who all are at risk of these dark circles?
Yes, as I told you, the people who have, some of the relatives, especially the females who have their mothers or their grandmothers, they will tend to have more. People who have chronic eczema, like they have from the childhood, they have dry or rough skin around the eyes, so that they keep on rubbing. They have some kind of eye allergies, so that they are always rubbing the eye. There is watering from the eye, so those people will have more tendency, because the dryness, it leads to post inflammatory hyperpigmentation, and which gives an impression of dark circles. Then the people, the females, especially with iron deficiency anemia, other kind of deficiencies like vitamin B12 deficiency, they will have more, dark circles are more common in these. Then, as I told you, the thyroid and the people with hypertension, for example, uncontrolled hypertension, or they have some renal issue, they can have puffiness of eyes, and puffiness again gives an impression of dark circles. Then aging, as we age, the dark circles appear more, because we lose our fat which is beneath our eyes, we lose the collagen, so they appear more sunken, and the wrinkles start appearing, fine lines start appearing, they look more puffy, the vessels, blood vessels become more prominent. So you see, it's a natural process. When we age, the dark circles will be more prominent. Then, if talking about exogenous causes, those people who have faulty lifestyles, as I told you, they are smoking a lot, drinking a lot, not sleeping on time, not taking care of the stress factor, always in stress, always in front of laptops, mobiles, those people will have more tendency to have dark circles.
Are these dark circles are permanent?
Yeah, that's a very good question, Divya. See, for some people, they don't know that whether they are having dark circles or not. In the beginning, I told you the problem is quite common, but unfortunately, people just think that, oh, they are there, and we cannot do anything about them. And so they don't treat the underlying cause. See, if we are able to point out the underlying cause, because see, if a young female comes to you and she has a good lifestyle, everything is normal, but then we see that her hemoglobin is just 8 or 9. So when you point out the cause with proper history and examination, and you are able to address the cause, not only just apply any under eye cream and that will work. No, you have to treat the patient wholly. So if you are taking care of the cause by taking the proper history, I think the dark circles are very much treatable, and you can't say that they are permanent. And unless there are some factors which are not under our control, but otherwise, most of the times, they are very good results with proper treatment and diagnosis.
Yeah. Thank you, ma'am, for sharing like dark circles are permanent or not. So, how can we prevent the dark circles?
Yeah, so this is again very important. Prevention is always better than cure, as it is always said. So prevention, especially when the youngsters, they come to us, I always advise them in general about the lifestyle changes. So now I'm talking about the exogenous causes. The things that we can make changes in our lifestyles is to limit the screen time, sleep on time, and take a regular exercise or any form of outdoor activity. Do proper eye exercise, give break to your eyes, keep moving them, use all the muscles. And as much as we take care of our body, we always forget to exercise our eye muscles and give rest to it. Nowadays it is very difficult. Apart from sleeping, we are always, most of the times, into either children are in front of TV or in screen. So limit the screen time and eat a proper healthy diet which is rich in vitamin C and iron, because iron and vitamin C status is very important. So if you're taking care of your diet, your lifestyle, and yes, if you have any chronic skin problem around the eye, like you are always having dry eye, keep it well moisturized, and don't rub your eyes frequently. Some people, they keep on rubbing and scratching, so that can lead to very permanent pigmentation. So let your skin specialist treat the condition if there is any, treat the vitamin deficiencies, and if you have any error of refraction, use your glasses properly. And so if you take care of all these things, I'm sure that you won't end up having very dark circles which are very difficult to treat then.
So, before moving further, viewers, let me tell you that eGlobal Doctors is providing diet consultation. We have a variety of featured categories as diabetes remission, detox program, weight loss, child nutrition, gut health, and many more. So, you can get the proper nutrition coaching from our expert nutritionist at eGlobalDoctors.com. So, moving to our next question, Lata ma'am. So, as you explained about the prevention tips, so my next question is like, are there any home remedies for dark circles and are they effective?
Um, before coming to a skin specialist or even before going to some medical store to get a medicine, especially I'm talking about in India where people do try home remedies, but let me tell you, Divya, I am not a big fan of any home remedy whatsoever because we generally deal with people who, come with many complications after using home remedies. So, if you ask me to use a home remedy, I would say that it is better to avoid any home remedy without, because nowadays people are too much information from WhatsApp, from YouTube, and people are trying aloe vera, and some people are even applying lemon juice under their eyes. So I would say that they shouldn't try anything without any proper knowledge and scientific evidence of that particular but yes, I would say that people who are suffering from puffiness, like when you wake up in the morning, some people complain that हमारी आंखें सूजी रहती हैं, and most of the times they have puffiness, especially the people who are towards middle age, because after a certain age you lose your collagen and subcutaneous fat, and because of that the eyes, they appear to be puffy. You can always apply eyes, that's a temporary relief. And of course caffeine and green tea bags, the tea bags will definitely improve the puffiness because they have vasoconstrictive properties. They constrict your blood vessels, they improve the circulation. And definitely if you apply clean and if you keep this tea bags in the fridge, you dip them in cold water and then you apply, it is definitely beneficial for the puffiness. Some people they apply cucumber, some people it is very common to apply potato juice under the eyes. Yes, they have got certain ingredients which are supposed to lighten the skin, but then I would say you don't know what is causing your dark circles. So before applying any XYZ thing, let your doctor assess, your dermatologist assess, rather than applying things randomly and then landing up into complications.
Yeah. So, Lata ma'am, as we discussed about the home remedies and their effectiveness, so what are the different treatment options available for under eye darkness?
Yes, this is a very important. You have to understand even before coming to a dermatologist. I'm not against people going and buying the under eye creams, but what ingredients you have to look for in an under eye cream, not just randomly spending money, wasting your time, putting anything. So first, you have to be clear that what is your concern, what is your age, what is bothering you, whether your eyes seem to be very dry or rough, whether you think they are very swollen, puffy, you think that you have lot of wrinkles around your eyes, or your eyes don't look hydrated, you always feel that as if they are dehydrated. So we have, again, I come to the same point that you have to know the cause, whether you have chronic itching or you feel that your skin is dry. So whatever ingredients you choose, it has to address a specific skin problem. For example, if you are only concerned about the color, that you need lightening, then there are certain ingredients like niacinamide and kojic acid. Then there are some lightening agents you have to look for, licorice. So these are some ingredients you have to look for. For example, if you have very dry eyes, then you have to look for products like vitamin E, glycerin, shea butter. Then there are some moisturizers which are very good, hygroscopic substances like hyaluronic acid. Suppose you are aging and you feel that your eyes appear sunken, dehydrated, you can use creams containing hyaluronic acid to give you that plump appearance. If your concern is mainly too many wrinkles are visible, you can choose retinol based creams, which are very good for, under eye wrinkles and They help in collagen formation. And similarly, if you have bluish discoloration, some people, they have bluish blackish discoloration under the eyes, and that is because of the poor circulation of blood around the eyes. Then vitamin K based creams are very good in those cases. Then if you have puffiness as your main concern, then as I told, the green tea based creams, there are some creams which have caffeine and green tea in them, then you can choose those creams. And most of the good quality and good brand under eye creams, they have all of them, because most of the times you have all of the concerns. You have dry skin, then you have pigmentation, you even have started developing wrinkles, sometimes you feel they are puffy. So most of the creams, they have that particular ingredient, and most of them have all of them. But yes, if you are aging, if you are 40 plus, then you should primarily look for retinol based creams. So this is one of the part of treatment. The lightening creams or the under eye creams is just one treatment of under eye, darkening. But if the creams are not helping, for example, 3 months, 4 months, and you have made sure that iron status is okay, thyroid is okay, you have corrected the deficiencies, the lifestyle is okay, then you can go with the other treatments. You can go with certain lasers like Q switch lasers. You can go for mild chemical peels and things like that. So there are many treatments to step up once you have ascertained the cause of the dark circles. That they think that the eyes are very sunken. That is again because of the age factor, because you lose the fat here. So fillers are a very good treatment option. Then fillers say the eyes, they look more plump, and so there are a lot of treatment options available apart from the under eye creams.
Yeah. Thank you, Lata ma'am, for sharing different treatment options for under eye darkness. So, as you mentioned about the creams, so are over the counter under eye creams are safe or not?
If you have some knowledge, and when before buying, you know what you are buying, you know that the brand is trusted, good company, good quality, and so most of the times they do no harm. And the over-the-counter creams, many good creams are available, which have all, some have vitamin K, some have green tea extract, some have all of them, niacinamide, kojic acid, hyaluronic acid. Then there are peptides. Peptides are also very good ingredient. They help in collagen formation. They give a younger look to your eyes. So once you know what you are buying and it is of good brand, they do no harm. But yes, if you find that they are not helping much, then there is a time to assess your condition from a dermatologist. But generally, they are safe.
Okay. So, Lata ma'am, as you mentioned about the creams, so like how to choose the right cream and what are the ingredients to be looked in an eye cream?
Yeah, I think Divya, I have already answered this question, that the ingredients we have to look for are depending on your concern. If you have mainly concerned about fine lines and wrinkles, go for retinol based creams. If you want your eyes just to be good, moisturized and hydrated, look for hyaluronic based and vitamin E and glycerin based creams. And if your concern is primarily that the eyes are really dark, then you go for lightening agents like niacinamide, kojic acid, licorice, vitamin C, ferulic acid. Then there are antioxidants, peptides, and the list goes on.
Okay. Thank you, Lata ma'am, for sharing the like how to choose the right cream and what two ingredients we should look in eye cream. So moving to our next question. So can we apply like makeup if we have the dark circles?
Yes, why not? I mean, most of the times it is just of aesthetic importance. People, they are mostly coming to us just because they don't want those dark circles to appear. They are not so much worried about what is causing them, but they just want that they should not appear. So till your treatment is effective, until your treatment starts working, you can apply good quality concealers. It's definitely no problem for that.
Okay. So Lata ma'am, like when to see a dermatologist if we have dark circles?
Yes, as I said, you can, of course, try any over the counter cream. Most of the people, before coming to us, they have tried But if you think that they are not helping, they are causing more harm than good, and so it is always better to come to us to get your condition assessed and then take the right cream for right duration or the right treatment, not just the cream. We have a lot of other treatment options. So I would say that earlier you come to us, the better the results would be. So that is my take home message.
So, Lata ma'am, thank you for sharing the causes, treatments for the under eye darkness. So, can you provide a summary on some practical take home message for dark circles to those audience who just has joined us?
Yeah, so I can just summarize it the way that the eyes are as important, they are most important part of your body, not only because they help us to see, but also because the skin under the eye is very delicate. It needs special attention. You have to moisturize your under eye area properly. You have to wear glasses before you go outside in the sun, and you need to wear a good SPF. You need to correct any error of refraction if you have. You need to sleep properly. You need to give rest to your eyes, and you need to exercise your eye muscles. You need to eat good to have healthy under eye skin, and moisturization is very important part of your daily routine, especially the under eye area. And these are also the measures to prevent the dark circles, and to eat healthy and to sleep well, and whatever be your whenever you feel that the under eye circles are getting darker and you have any problem around the eyes, you have to consult your dermatologist as early as possible rather than trying random things at home. Thank you, Divya. Thank you for having me. And even it's my pleasure to, provide whatever information is helpful for the viewers. Thank you for having me.